Well, good morning, everybody. My name is Eric Utzinger. I'm CEO and co-founder of Revuud. Revuud is a platform anchored in IT talent search, and we are designed to build and manage an interim workforce. Having been in healthcare IT staffing and consulting for over 10 years, I saw a big problem. Locating the right talent at the right time for the right project was costly, time-consuming, and inefficient. It was preventing project work from getting done on a timely basis, and really just the expense of doing so has really put projects behind at hospitals as we started doing business with them as the market matured. Our market in the healthcare IT space alone, which is our initial beachhead, is over $7 billion industry with over 6,000 consulting agencies and over 6,000 healthcare organizations. Fact is, though, our platform would not have succeeded years ago, but due to a mature IT market in healthcare, along with factors such as a global pandemic and a growing demand on how people want to work and the accessibility of remote work has really propelled our value proposition. And at the end of the day, we're going to make it very easy to facilitate the management of your interim workforce. As an example, Adam is a worker who has uploaded his profile and availability to work in Revuud. Roger is a director at a hospital with multiple projects coming down the pipeline, multiple IT applications that he has to support, teams that have to go build. COVID teams, for example, in some of our discovery recently, not enough time to take care of the day-to-day or get the project demand done. But Roger, if he works effectively and brings workers into the platform, he can have accessibility with onboarded resources with security access, ready to work and meet his project demands. Our solution not only makes it possible, but easy. We're using sophisticated graph-based technology and managed taxonomies to allow you to search a trusted and proven interim workforce, but to be able to build that accordingly. Worker profiles are built to identify the role, skills, certifications, and your availability. Simple searches for components and skills can then be refined for facets from our knowledge graph. Searchers can actually get notified when resources are available, and alerts can be saved and created. Searchers can also invite workers into the platform through Revuud to say, I want you to be a part of our interim workforce. We can further value by making it easy to facilitate all the onboarding documentation, timekeeping, and invoicing monthly. We do have competitors. LinkedIn Recruiter, from a search perspective, is probably the biggest one we've seen, obviously. Pretty big network of people out there, and it's where agencies go to first to find talent, along with their own internal processes. There's a huge agency market down here in the corner here, hundreds and hundreds of those. There's some vendor management systems, Fiverr's, Upworks of the world that I'm sure everyone's heard of. They're simply just not focused on the healthcare IT market, which is our beachhead and a huge market in and of itself. Graphite is probably the closest one we've seen. They've gotten $4.5 million in funding as of recently, and they're more broad-based horizontally, where we're vertically in the specific to healthcare IT. So how we are different. Revuud, as I said, is hyper-focused on our beachhead in healthcare IT, knowing we can expand to other markets. But the healthcare IT market in and of itself is a huge, huge opportunity for us. We're not a social media platform. Our platform profiles are much more precise with multiple availability settings allowed, and workers can request skills validation, and searchers can search based on that to find the right talent at the right time. Our traction, we've got our MVP up that we can actually start demoing and showing some product. We're in conversations with multiple hospitals, some local large facilities here around functional requirements. We've got workers waiting to get into the platform. We're going to test that workflow, and then about 15 agencies that are willing to look for use it up from a search perspective once we have those going. We've got followers on Revuud, and so having been in this market for so many years, I think we can get the scale on both the supply and the demand side pretty quickly, but really that invitation via viral growth will make it pretty quick to expand. So we make money, SaaS-based model, but also on the per hour worked and when we create the invoices. We've got founders, sales and marketing experience, co-founder that has built and scaled engineering teams, advisors that have been there in this market and know how to build companies. We've got some milestone projections of people in the platform, along with the number of agencies using or hospitals and agencies using our platform through 2023, with our revenue plan into close to 8 million in recurring revenue. And that's it. Thank you.
All right, another Zoom virtual clap there for Eric. Good job. 5 minutes goes by very quickly.
You think it's,
we know this.
It's not.
All right, Garth, Dr. Shante, take it away.
Sure. I think it's my turn to go first. Eric, this is a great job. You know, even though Juan mentioned one of my my pet peeves with lots of other presentations, they don't use the time correctly. You hit all the three things that I want to see. You know, a little rushed at the end, but you know, overall great. Very, you know, very polished. You know, you're obviously, you know, this is well practiced. I mean, this is a good presentation. You know, it's like, you know, you hit the market and not, you know, with enough detail for a 5-minute presentation. You know, because the most important thing when I'm looking at it is the market, then who's doing it, and then what the actual idea is. And so you hit all those. I feel like you personally have good experience, and the people that you've got associated with, like, you understand this market, you've lived the problem. The way you're going after it with, you know, number of hospitals, you know, to continue to get information. You integrated in how COVID is affecting your business and how you've innovated. I will say, full disclosure, that you and I have met before, and we've talked about your business, so I've seen some changes. So that is an advantage that you had over the other two. So I had to call you out, but this was really solid. One little nit on your slide where you were talking about the market, what the slide said was 1 billion and you said 7 billion. So I don't know which it is, or I think that someone would just, I'm sure it was just you weren't talking about the same thing or something, but it was just a nit. Yep. I think that's really all I've got. You know, sorry to not kind of put you through your paces, but I think this is pretty solid.
No, I appreciate it, Garth. Thank you very much.
I have not met you, and I agree with everything that Garth says. So first, this is squarely in my wheelhouse since it's healthcare. But I think it's a pretty timely business to be in, especially as COVID has kind of sucked all of the oxygen out of the room. And so other things are essentially, you know, languishing in a lot of areas. So I love really the focus you've got here, and knowing that you can scale up or down at any given time. On the IT side now, I will say, I was thinking on the clinical side of things, you know, especially as we're going to need a ton of people to deploy vaccines. You know, we clearly may have surges in the needs for physicians. I mean, I see the applicability, but I appreciate your specificity, especially in the time of telemedicine when it's really taking off. And I've seen hospitals adopt platforms and need that extra technical support because they don't have it internally, but they're not going to need it forever. So I'm a fan. I definitely think, I think this is pretty interesting. I don't have I have questions more on how you're getting into hospitals, selling into them, but I would say in this particular arena, I don't want to take you through full-on due diligence because I would say my investor hand is showing in this particular regard. So I actually like what you've got a lot. I do think that you've called out appropriately your competitors. I just have maybe a logistics question. How long, and I may have missed this, how long are teams on and off? So if you're pulling on a team, you know, they come in for, is it 3 weeks? Is it 3 months? You know, what does that look like?
Our goal that it would be to make it however much you need. And a lot of these folks in the change, and I've read so much around the future of work in lots of industries, but in the way that millennials and younger generation want to go work. And then all of the consultants out there, my huge consultant network that is saying, hey, I'm open for more hours. I've got some availability. So when we go through a demo of the software, you can say I'm available for 10 hours on an Eastern time zone or Pacific time zone a week, or I'm looking for 20. And so you as a manager might reach out to that resource and say, I need you for the next 3 months for 40 hours a week. Okay, great. Confirm, good to go. But you might only say, I need you for 5 hours this week. I need some support work. My Radiant tickets are out of control. I need your help. And you come in and just kind of come in and out. And as we were doing a discovery call yesterday, and it's one of the things we talked about was after 3 months, if they haven't worked for 3 months, their security gets cut off. So it's just monitoring that and just knowing that we got to flip that back on. So our hope is that if it's an hour, it's an hour. And agencies don't want to deal with those ins and outs of bringing people on because they're not full-time employees. They're just contract. And that's what we're trying to get over. And I'd look forward to talking to you with your background as well. Just some of the things around the freelancer market or in healthcare IT are unique that Upwork freelancers don't have those same challenges. So those are kind of our next step discovery calls with some health systems around what you would need to make this facilitation happen. So
awesome. One other question as it relates kind of to the IT side of things. I have invested in a few different telemedical platforms over the last 3 or 4 years or so. Getting physicians or clinics trained on technology, does that fall into the IT bucket as far as, basic troubleshooting? I mean, we all have had Zoom connectivity, but even having somebody that's literally on call because I need to, do this consult or whatever, is that a part of this model?
I believe it absolutely can be. One of the hospitals we're speaking to, a large health system tomorrow, she's in charge of all training for, the entire network. And so not only when they go live, but post training, and we call them physician support teams. So my hope would be is they use this as to say, I don't have to pay this person 40 hours a week or guarantee them. It's just you can have a calendar of your availability, and then doctors, that's who they go out to, nurses, when they do have these challenges. So we're kind of on the cusp of being careful of not being everything to everybody and staying focused to get people on the platform. Because a lot of people give us ideas of what they want to see, and you just, and sales guy in me wants to deliver everything everybody wants, but not my CTO keeps me focused. So.
Well, that's good. I was going to say hospitals are very good at giving you something that's super customized for their particular needs that may not be applicable to another clinic or another system, or, so I applaud you. Stay focused. Hats off to that CTO, because trust me, your next several discovery calls are going to be, oh, we need this one thing, and you'll spend a ton of time customizing or over customizing for something that, may be completely throwaway later. So I appreciate that. Laura, I think you're upside down. But no, that's it from me. I look forward to staying connected and hearing more.
Yeah, great. Thank you. Thank you both. Thank you,
Awesome.
Laura.
Thanks, Eric. Stay on for just a second. We've got another question here. Unless Garth, you've got anything else you want to add?
No, let's go to the group.
Yeah, we've got a couple questions here in the chat. One of them here from Dan Komisar. Can this be a digital tool for traditional recruiting firms? It could be complementary to their lower tech model, i.e. a white label SaaS solution that may alleviate vendor management and hurdles with large hospitals.
Yeah, Dan, thanks. And absolutely, it's kind of interesting. I note the agency as a competitor, but at the same time, it's a market I know very well. So as I said, 15 of those organizations, I've got demo with one agency already, another one that says this is where we can build our worker pools, communicate with them effectively. And really, my goal is that when I reach that cusp of 10,000 consultants, IT consultants or more, this is the place those agencies go. And I have had people ask about white labeling. I've had construction companies ask to white label it because those people are not on LinkedIn. So there's other ways to white label the solution. But again, going back to staying singularly focused right now as we develop it, But yes.
Awesome. Thanks, Eric. Appreciate that. Thank you so much. And